So my name is Christy Denkla. I am a research associate at the Harvard Chan School of Public Health and Department of Epidemiology. And I'm really excited to be here today to host Nick Obradovich, who's been gracious enough to join us to speak today about some of his research in climate change and mental health. So I'll do a brief introduction and then I'll turn it over to Nick to start his talk. So Dr. Obradovich is a senior research scientist and he's principal investigator at Max Planck Institute for Human Development in the Center for Humans and Machines. And this is an institute in a super cool place in Berlin, Germany, but he is speaking to us today from Bend, Oregon. So we're also excited to welcome Nick back to the Boston area virtually, as he did much of his work well here in the Boston area at MIT and Harvard in climate change, mental health, where he authored a number of really high impact publications, some of the really fundamental work and empirical studies of climate change and human and mental health. So Dr. Obradovich worked as a research scientist at MIT Media Lab. He holds his PhD from the University of California, San Diego, and he completed his postdoctoral training at Harvard University's Kennedy School. So he's a Human Environmental Systems Fellow, also at Scripps Institution of Oceanography, and a research affiliate in MIT's Environmental Solutions Initiative. So I'll turn it over now to Nick to speak on his talk today. Thank you.
Thank you, Christy and Becca. I appreciate the introduction. So I'm going to try now to share my screen and see if it works. Let's see. All right. Are you able to see the screen? All right. And I will get going then. So, as Christy very generously put, I'm a senior research scientist and principal investigator at the Max Planck Institute for Human Development. I am trained primarily as a data scientist, as a kind of empirical political scientist, and then I transitioned into the study of the empirical social impacts of climate over the last 5 years or so. And so for the talk today, I'm going to go briefly into the social impacts of climate and what it means to study broadly the social impacts of climate. I'm going to talk a little bit about how mental health fits within that framework. And then I'm going to walk through a particular study that we did related to climate impacts and weather impacts on mental health and mood and emotion. I'm going to walk through the methods that we use to kind of conceptually identify in a causal sense the effects of climate on sentiment in this particular case. And then I'm going to talk a little bit about sort of future directions for where I think a lot of this empirical work could go and the value of bringing in ever better data sources in terms of improving measurement. And then I'll conclude with a few outstanding problems. So what does it mean to study the social impacts of climate? And with respect to this talk, why does this study matter for mental health, broadly conceived? And the idea behind the study of the social impacts of climate is asking a very broad question. How do climate variables, broadly conceived, climate, weather, natural disasters, unusual events, impact individuals, groups, and societies? And we are not the first to start to wonder about these kind of questions. Questions about how humans relate to the environments in which they live have been around for millennia. Hippocrates in 400 BCE said a changeable climate induces laborious exertions of both body and mind. Thinkers throughout the ages have discussed and wondered the role of climate in shaping human individual well-being as well as societal outcomes. Why should we care about asking these questions now as opposed to the hundreds of years that we've been asking them before? Well, there's particular import brought about by a changing climate, and more specifically, these questions now have become of direct import to potentially planning for adaptation strategies, appropriately costing the social cost of carbon, which allows a more appropriate price to be put on carbon, as well as disaster response targeting and following up socially in response to disasters. But I do want to emphasize that in a sense, one of the reasons why this area of study has kept me interested for so long is that it's not just that we are asking questions about climate change, we are asking fundamental questions about the way that humans relate to the natural environment around them. And many of the studies that we do provide insight into those questions. The literature in the social impacts of climate more recently, the kind of more quantitative and specifically careful statistical approach to looking at the social impacts of climate started out with large-scale, big impact questions. Could climate change alter the risk of conflict, interstate conflict and intrastate conflict? Might climate change alter economic production globally, and GDP globally? And could climate shifts and sea level rise produce mass-scale migration, and what might be the political effects of that? And so a number of pretty well-known studies and impactful studies occurred around 10 years ago, asking again, what's the relationship between exposure to El Nino and changes in conflict risk, and how does a country year temperature alter their GDP in that year, and how does that effect vary across the globe? And so you had these very big questions at an aggregate level, and that we're then also using aggregate data to be able to answer them. And around 5 years or so ago, I started to wonder, well, okay, we're talking about a lot of these really large scale impacts using large scale data, but they all aggregate from something. And big or rare societal events aren't the only thing that climate likely affects. We're exposed to the climates in which we live on a daily basis. And so might there be day-to-day individual level impacts that are not necessarily captured if you only look at more extreme events like conflict, for example. And so one of the questions that I and a number of colleagues have been asking over the last decade is more specifically, how does climate regularly affect us? And we're not the only people to ask this question. Obviously, there are hundreds of scholars across the disciplines that ask these sorts of questions. But one of the things that we were initially interested in, and that I kind of thought would have been better addressed statistically and empirically, is whether or not climate exposure, weather, and specifically warmer nighttime temperatures, alter individual fatigue and sleep. And we found through a large-scale study of ambient exposure to nighttime temperatures that yes, indeed, climate affects sleep. And other scholars and some of my colleagues have been asking questions about the role that climate and temperature might have in altering day-to-day cognitive functioning. And there have been a number of findings from this literature that have found that indeed individual cognitive functioning is altered by exposure to different weather variables and different climate regimes. Does climate alter time use or our mobility patterns or our physical activity and our exercise patterns? A number of studies have looked into this area recently and found, yes, indeed, our exercise patterns are altered by the climate that we experience, and our mobility patterns, as well as what we choose to spend our time on throughout the day. Many studies have looked at the relationship between climate, particularly hot temperatures, and individual mortality rates, and found that unfortunately, indeed, there's a pretty strong relationship between climate and hot temperatures and mortality, as well as to a lesser extent cold temperatures. So one of the things that I wondered a few years ago was, okay, so we're starting to see physiological effects of climate. We're starting to realize that the climate change is going to expose populations to historical weather distributions that they didn't historically face. Might the physical impacts, the physical stressors, combined with or separately due to the other social impacts of climate that have been identified, alter psychological well-being? And more specifically, by psychological well-being, I mean things like our emotional states, our kind of meso-level mental health outcomes, all the way up to potential suicidality and suicide. And from some of these studies, we found that indeed our mental health status does seem related to the climates that we are exposed to on a day-to-day basis. I want to make a point here, though, to note that we're by no means the first to ask the question of whether or not climate and climate events can influence mental health. In fact, there's a huge literature looking at the mental health effects of exposure to natural hazards and natural disasters, and pretty much across the board finding fairly large effect sizes between exposure to a natural hazard, a natural disaster, a hurricane, a flood, and long-term complications from the trauma that that exposure can induce. We found evidence consistent with this in one of our studies, but the focus that I have taken and kind of what I've emphasized a bit more is the potential day-to-day effects of slight variations in underlying temperature distributions on mental health status and quality. So I'll talk about that in a second. And you know, the reason why I ask what about these more regular day-to-day effects is this notion that even if the day-to-day effects of slightly different temperature exposure are relatively small, because everyone is exposed to them around the clock, the cumulative dynamic effect, the cumulative effect of this may end up being actually quite large, even if the day-to-day effect, the day-to-day delta is relatively small. So what I'm going to do now is talk a little bit about how one starts to investigate the relationship, the causal relationship between the temperature that we experience, the precipitation that we experience, the climates that we live in, and our mental health status or our emotional status. This is a form of observational causal inference, and in this method we use climate econometrics. I'm just going to give a very brief kind of general peek under the hood of what the ethos of the estimation approach is. I'm not going to talk about any models or any statistics really here. So taking a step back for a second, one of the things that I wondered, I think it was about 2014 or 2015, was, hey, I've read some literature, I've looked into the social psychology literature, and there's been a good amount of work trying to ask the question of how mood and affective states relate to the weather outside. And for a good amount of the history of that literature, and some of the most kind of cited and iconic papers in that literature used relatively small data sets and found remarkably large effects from those relatively small data sets. And then subsequent work came along and used slightly larger data sets and somewhat more careful methods and found there was really no relationship between the weather outside and the temperature exposure that individuals faced and their affective states. And so there was a kind of still open question, unanswered question in the literature as to whether the weather outside influences our day-to-day well-being. And the theory here is basically that if you just look at temperature, which is what I'm going to talk about here, though we do look at the other variables, the idea is in extreme temperatures, human well-being suffers perhaps directly as a result of the physical stressors caused by being cold or particularly hot. The data that we used here, and the reason why we pulled these data in was because of the hypothesis that I had that basically the previous data sets didn't have enough data or resolution to be able to identify what are potentially a little bit smaller effect sizes. So we pulled in 2.4 billion Facebook statuses from one period, 2009 to 2012, 1.3 billion geolocated tweets from 2014 to 2016. We mapped those to daily meteorological conditions that the individuals posting those faced. We aggregated to the city level for our main analyses, though we also did robustness checks at the individual level. And what we did here is we had billions of texts, billions of short texts that individuals posted online at different times, and we took the sentiment expressions contained in these texts using a number of different sentiment measures and collapsed those sentiment expressions into two dimensions, the positive affect dimension and the negative affect dimension. I'm going to talk about our analysis of the positive affect dimension here, but the negative affect dimension is basically just the inverse of what we found for the positive affect dimension. So what we have is for each city day in the data, we have an observation for the temperature for that city on the day and the average positive sentiment for that city on the day. And on the x-axis plotted here, you have maximum temperature in degrees Celsius, the y-axis positive sentiment in percentage points. And this is just a simple raw data correlation. The black line plots the bivariate correlation between these two series. And so you might be tempted to say, okay, well, there's a slight positive slope there, meaning that warmer temperatures help produce better sentiment. But one has to be careful. By the way, the orange dots in all of these plots represent a 5-degree non-parametric mean smooth. They're basically just a mean for that particular range of temperature. You might ask, okay, you know, does this tell us something fundamental about the nature between temperature and positive sentiment? And one has to be very careful with that kind of inference. A number of studies in the past literature had basically just done this levels-based correlation of these data. And you have to be really careful because, like any observational data, you have spurious correlations with secular time trends. You have potential for confounding, where seasonal factors or constant factors are confounding or biasing the inference. You have possible selection dynamics, where people have selected over time to live in places that they prefer. And so, you know, the trite and true forever correlation doesn't imply causation applies here. But the critical insight is that sometimes if you're careful with your estimation method, if you're careful with the data and the way that you treat it, sometimes you can set up a study that can imply causation, assuming a number of assumptions are met. So the core question here in the climate econometrics field is, how do we carefully identify the causal effect of climate and weather on social outcomes? And specifically to this study, the question was, what's the causal effect of weather, or in this case we're focusing on temperature, on sentiment? Conceptually, if you had perfect power and control over the world, you could set up an ideal design. And this ideal design would say, okay, we have all these cities in the United States. Let's separate them into 2 groups and randomize them to we'll take a random sample of these cities. One group will be exposed to warmer temperatures. One group will be exposed to cool temperatures. We'll then take the mean of the sentiment in the 2 different groups. We'll do the mean difference, and that will provide us with the treatment effect of being exposed to warm as opposed to cooler temperatures. We can't run this experiment. Well, we are running an experiment, but we don't have a control. But conceptually, we can approximate the experiment on the previous slide by observing temperature over time within the same location. We can then deconvolve potential confounds from the data. I'll explain what deconvolve means on the subsequent slides. And then treat the remaining variation in temperature as what we call exogenous to outcomes, or as randomly assigned to the outcomes that we're interested in. And then these outcomes correlation with anomalous temperatures can give us a causal effect, an estimate of the causal effect between temperature and the outcome that we're interested in. So this is the kind of conceptual underpinning of what we do in a lot of these climate econometric studies. And the core question, kind of from a what's going on here at a real simple level, is actually just asking, is today, in the location that I live, a little bit warmer, a little bit cooler than it normally should be on this day of the year? In other words, is there a temperature anomaly today? And so to kind of see this visually, I'm a visual learner, so I'm walking through this visually. To see what this means visually, I've plotted one city's time series in this chart. With the left panel, on the y-axis of the left panel, we have maximum temperature in degrees Celsius. The x-axes for both panels are basically the date, the time. And on the right-hand panel, we have positive sentiment and percentage points. And so this is Columbus, Ohio. I was born in Columbus, Ohio, and I chose it for that reason. And it also has nice seasonality for visualization. But what you see here in both panels is just the raw series. One is the temperature throughout the year in Columbus, Ohio, and the other is the positive sentiment and percentage points over time. You can see there's a slight secular increase in positive sentiment on Facebook, at least in Columbus, Ohio, over time. So one thing you might be concerned about is that maybe Columbus, Ohio, just on average is different. It's warmer on average, it's more positive on average, and if you didn't account for that fact, you might have a biased inference. So one thing that we do is take out what are called city fixed effects. This recenters the data around the city mean for the series. But you can still see that there's variation over time in temperature and secular trending over time in the positive sentiment series. Those things could be due to potential confounders. And so what we then do is take out city by month, which are city-specific time trends, as well as date fixed effects, which are date constants across the whole series. And that leaves a deconvolved series, a series of data that have been deconvolved from potential confounding trends. And what you have then are these 2 remaining series, where each point in these series represents an anomaly in maximum temperature in degrees Celsius for Columbus, Ohio, as well as anomalies in positive sentiment for Columbus, Ohio. The remaining variation in temperature, the remaining, the daily anomaly, whether today was slightly warmer or slightly cooler than we would expect for Columbus, Ohio, we can treat as good as randomly assigned to the remaining variation in sentiment. And this is an assumption that then provides us a natural experiment where we can try to draw direct inference. So taking all that, doing that process for all the cities and plotting the data, we have on the y-axis positive sentiment anomaly percentage points, x-axis maximum temperature anomaly, and you could just plot the deconvolved data in this manner. And you might conclude that, again, we see a positive relationship, pretty linear and positive relationship between maximum temperature and sentiment. But it's very different to have a slightly warmer day in the wintertime, potentially, than it is to have a slightly warmer day when it's already 40 degrees Celsius, 100 degrees Fahrenheit outside. So what we do is to effectively conceptually break this process out and run that regression, run that simple regression heterogeneously by each bin of the underlying temperature distribution. So on the bottom panel, you can see that if you break out this regression by 5 degrees Celsius bins, that in cold temperatures, a positive anomaly in temperature, if it's a bit warmer, is good for your sentiment. You get a positive sentiment anomaly. And in very hot temperatures, if it's hotter than normal, you have a reduction in positive sentiment. There's a model that goes into the top figure. I'm not going to get into that right now, but happy to talk about it in question and answer. So that's kind of this is the core method underlying how we try to answer the day-to-day exposure question. Different methods would be used if we were trying to answer the direct exposure to an acute natural disaster, but this is the approach that we use for daily I'm exposed to the weather outside. How does that affect daily my well-being? So I'm going to talk a little bit now about one of the things that I think is really important going forward in this area, and that is measurement. And I'm not unique ever being a scientist saying we need better measures. I recognize that. But I think that here, especially, we can learn very important things that from better measures that are actually really important for policy-related questions. So we started out in this area of climate social impacts, a lot of the economists and political scientists working on the country year level. And that's important. You can see aggregate trends that you want to dig into more. For example, the relationship between country year temperature and country year GDP, what's going on under that. Subsequent studies started to dig into subnational analyses and subnational results. For example, toll returns and the temperature that people were exposed to just prior to those elections. But where I think the future is here is working with these very high resolution, unobtrusively collected person-second analyses based on really, really high resolution data. And there are great values to be gained from an inferential standpoint using these better data. I'm going to walk through a few examples from my work here just to kind of give a sense of why I think it's so important to use these better measures that are coming available. So I mentioned earlier that I have done work on temperature and sleep, the exposure to warmer nighttime temperatures on sleep quality. And we published this paper a few years ago now, where we pulled data from the CDC's Behavioral Risk Factor Surveillance Survey, BRFIS for short. And the measure that we had here was a person-month measure where we counted the number of monthly nights that a person reported having insufficient rest in the US. We mapped that, and that was over the previous 30 days. We mapped that 30 days to the city in which the respondent was located, and were able to match their reports of insufficient sleep to the nighttime temperatures that they experienced. And what we saw was that pretty much across the board, warmer nighttime temperatures worsened sleep quality. But this is a very coarse measure. It's self-report. There are multiple limitations associated with it. We couldn't answer questions like, when does sleep loss happen in the night? How much sleep is specifically lost per night? Is sleep quality or sleep quantity harmed? Is the effect being driven by sleep onset versus sleep offset? So there was an effect that we observed, but there were many, it actually opened more questions in a sense than it answered. And so what we did subsequently with a very excellent graduate student that I've been working with, Kelton Miner, we worked over the last few years to get actigraph data, which is basically the equivalent of a Fitbit band data, that the company had created a algorithm to measure when a person was sleeping. And so what we have is this precise hourly level geolocated calculation based on millions of person nights of movements globally. And with these data, we found a very similar main effect. In other words, warmer nighttime temperatures harmed sleep. And we found that pretty consistently across the temperature distribution, but we were able to answer more specific questions like, when does sleep loss happen in the night? How many minutes of sleep is lost? And is the rest-wake cycle disturbed? If so, how? And I think that, and I'll get into this in a little bit, but asking these questions about other physiological variables is really important to potentially understanding how these physiological variables influence mental health outcomes. I'll talk about that in a second. Did it also for temperature and physical activity, a similar approach where we used data from the CDC's BRFIS to map climate data and weather data onto the self-reports of physical activity around the randomly sampled collection of individuals in the US. And what we found was that it was really heavily cold temperatures that were dominating the temperature response to the physical activity response to temperature. And that on the hotter end of the distribution, there wasn't as much of a reduction. So if it was freezing outside, you were much less likely to engage in exercise. If it was 100 degrees outside, 100 degrees Fahrenheit outside, you didn't have quite as much of a reduction. And so actually, if you map this function onto projections for future climate change, what you can conclude is that across large portions of the distribution in the US, there will be increases in physical activity due to warming in winter months. And that's actually one of the things that we included in the study. We couldn't answer with these data, when in the day are people active? Do people avoid hot times in the day, or how much does their activity change as kind of the internal margins of activity? So, we had this course result, and we concluded one thing from that course result. But then subsequently, with a team, including Zhenghao Wang, who's an excellent scholar, we conducted a study using hourly counts at the park level in China of cell phones that are active in parks in China. And with these really high temporal resolution data, we're able to actually find that the reason that we didn't observe a huge net effect of reduction in physical activity on the hot end of the distribution is actually that there was substantial intraday substitution in the timing of physical activity. In other words, if it was really supposed to be very hot today, I go out earlier in the morning or later in the evening than I otherwise would, and still engage in some physical activity just by timing that activity more carefully. But I don't really do that on the colder side of the temperature distribution. The conclusion there, though, is that once we get past a certain point in the temperature distribution, physical activity will indeed, on net, reduce substantially. So it's an interesting example of when you can increase temporal resolution, you can have inference that shows that maybe prior inference was actually a little bit inaccurate in the underlying generative process. And then getting to temperature and mental health, which is obviously critically important. Resolution here matters a lot. It's also perhaps one of the most challenging things to improve resolution on. This is a study that we published in 2018 on the PNAS, and we did a number of different analyses, but one of the main analyses was just looking again at the exposure to temperature that individuals faced in the previous month and the effect of that temperature exposure on the probability that they experienced some mental health issue in that month. And what we saw was hotter temperatures increased the probability that individuals experienced a worsened mental health outcome. That was consistent with findings from some of my colleagues that did a very large study in US and Mexico, and found a pretty linear increase in suicide rates as a function of warmer temperatures. So we found this kind of consistent result, but again, there were lots of things we couldn't answer because of the resolution of the data, including, are there weekly variations in mood? How are intentional changes in mental health? Are positive moods less frequent, negative moods amplified, or both? And so we sought to dig into some of the affective state and emotional state measures that could give us answers to which type of moods are changing the most. Is there kind of changes within the week in mood, and how does that compare to the effects of temperatures? How large are the effects of weather compared to other large scale events in the data, given that we have this high resolution measure? One thing I'll note, and we can talk about it in more Q&A if desired, is, for this study and the study that I walked through, this is the same study that I walked through the methods on, we make an assumption that you can use the sentiment of natural language text expressions as a proxy for emotional states. That's a big assumption, and so I want to call that out explicitly. Another thing you can do that is really important, in my opinion, in this type of study, especially as it relates to mental health, is when you have lots of data on individuals as well as their demographic characteristics, you can better split and segment the populations to see, for example, how the elderly are influenced differently by nighttime temperatures than our younger generations, or people who are predisposed to having mental health problems. Do they react differentially to exposure to hot temperatures? If so, by how much? And so the more data and the more power you have to investigate all of these subgroups, the more precise we can be with respect to policy recommendations that come from our work. So I've kind of avoided this question up to this point. I hinted at it a little bit, but I think it's perhaps the most important outstanding question with respect to the climate, the impacts of day-to-day climate on mental health. And that is the why question. So it could be the case that we observe hot temperatures harming mental health quality and status because there is a direct physiological stressor associated with being exposed to warmer temperatures, and that has a direct causal effect on mood and affective states. It could also be the case, though, that the entire effect goes through sleep, and that your disrupted sleep in the evening produces a more grumpy affective state the next day. And by measuring that temperature correlation between that day's temperature and your affective state, we're really just picking up what is primarily an effect driven by sleep. And when I talk about causal mediation and its difficulty, I like to give the example of Lyme's and scurvy. And that is, for a long time, sailors were beset by the plague of scurvy, realized at some point in time that limes and citrus fruit help reduce the incidence of scurvy. But limes are difficult to store and keep on a ship for a long period of time. And so, and also scholars were very interested in why limes cured scurvy and what the mechanisms were, what the causal mechanisms were. And so via very careful design and study and experimentation, they were able to uncover the active ingredient that reduced the incidence of scurvy, which is vitamin C. We need to do a similar thing with respect to the social impacts of climate. In other words, we need to understand whether or not the primary effect is driven by loss of sleep at night, insomnia-induced mental health problems, or alternatively, whether the stressors caused by perhaps being less cognitively effective at work during the day are causing disruptions in affective state, which then spill over into nighttime stress and less quality sleep. And the causal arrows here matter a lot because we have a limited amount of funds with respect to adaptation and mitigation policy. And so if you're a policymaker and you have a limited set of funds, if you can change nighttime sleep behaviors and get rid of the mental health stressors associated with warmer temperatures, that is a very effective intervention, or you might want to choose that intervention as opposed to trying to address both independently or each effect independently. If for example, physical activity reductions in hot temperatures are driving increased worsening of affective states, maybe you want to figure out how to get people more physically active in those temperatures. And so exactly what is causing what is very important to understand for policy interventions here. A brief coverage of some other outstanding issues that I think are really important for us to think about. One is generalization. A lot of the studies that I've done, I'm guilty of this, and that others have done, have been sort of streetlight effects. We focused on asking the questions where the data are. And one really important, what that has led to is understanding these relationships pretty well in the US particularly, as well as other westernized countries that have good data and good data tracing. It's really important to expand these studies to other settings and see to what extent do the findings hold in those other settings. So again, with Zhenghao Wang and some other excellent colleagues, we did a study looking at Weibo sentiment. Weibo is the Chinese equivalent of Twitter, and temperature, and found similar functional forms linking maximum temperatures and the sentiment of expressions in China, suggesting that this is a more universal effect than just one that operates only in the United States. Similar things are needed for studies of suicides and suicidality, as well as depression and anxiety and more meso-level mental health measures. Finally, I would be remiss on a talk about climate change and mental health to not talk about the potential for adaptation. And I think this is another area that we really need to work on very specifically, and try to be very careful in our estimation, because in a lot of our studies, what we do is we say, well, here's what the relationship is between historical climate and historical social outcomes, including mental health outcomes. And if you make the assumption that the history will continue as it has, then if you change the underlying temperature distributions, you'll have this degree of worsening of mental health outcomes in the future. But that is an assumption, a very strong assumption, that assumes that individuals won't be able to adapt either privately or via public intervention to those temperature stressors. And so one example of a study that we did, Francis Moore and I and some other excellent colleagues in PNAS, we asked the question, are people becoming more used to the temperatures that they're exposed to? So if I'm in Boston in February, and usually it's 30 degrees Fahrenheit in Boston in February, but this year it's 70 degrees Fahrenheit. The first year that I experienced that on social media, so this is a study of Twitter, I remark at a very high rate about how unusual that temperature is in Boston in February. However, in the next year, if I experience the same 70-degree February temperature, I remark about it just a little bit less on social media. And then by the third year, I remark about it just a little bit less. And by the fourth year, just a little bit less. And by the fifth year, I remark about that 70-degree temperature increase in February in a way that is similar to how I would have remarked to the original normal 30-degree Fahrenheit baseline in Boston. And so what we observed was this very quick normalization of the remarkability of unusual temperatures. And so we observed pretty quick adaptation, especially on the scale that these temperatures are changing due to anthropogenic forcing. But what we also looked at sentiment. We looked at the sentiment of many of these individuals and wondered, okay, if you're exposed to unusually hot temperatures in August, year after year, does your sentiment, does the effect that those unusually hot temperatures have on your sentiment get smaller over a year? Are you adapting in some way? And what we found was that we observed reductions in the remarkability of those unusual temperatures, but we did not see substantial adaptation in the underlying sentiment effect of those unusual temperatures. People were not smoothing the psychological effects of those exposures as much as they were changing their expectations around those exposures, which, to be frank, was one of the more troubling findings that we've come across in our studies. So really considering how repeated exposure to changes over time alters underlying psychological resilience and our adaptability is going to be a really important step moving forward in these literatures. So just as a brief summary, we've come a long way in really trying to dig into the day-to-day impacts of climate and what those individual level effects might mean in terms of changes in well-being over time as they accumulate, but we have a lot left to do, and a lot of the open questions are very important ones to answer. So thank you all very much for listening and joining me today, and I really look forward to your questions.
Thank you so much, Nick. That was excellent. If you stop sharing your slides, then we'll be able to see. Perfect. So I have millions of questions, and we have some coming in, but let me just start with one, a sort of a broad sort of where do we go from here question.
Yeah.
So when I think of on a personal level, so climate change is the people I talk to, it says there's a bit of underlying panic here, the sense that things are changing in a way we can't possibly kind of even comprehend right now, and there's even a growing sort of public sentiment that there's more of an emergency happening that we really need to be proactive with. Now, I appreciate so much from your talk a very careful methodological approach in decomposition of sort of like confounders and measuring change over time, and looking at how these incremental exposures, because that is really in some cases what we're facing, although as I'm sure you know, climate change exposures can be very dramatic in some places, but you've addressed that, you know, the disaster literature is really, characterize that well for us. But when we think about adaptation, which is also a very important area of interest of mine as well, these incremental changes over time can facilitate an adaptive response, but in other cases, can they also kind of increase a chronic stress burden or a load for chronic stress? And how do we balance sort of our urge for action and policy, given, and should we be panicking, I guess, is maybe a question for you. Do you panic? Does this keep you up at night, or?
Yes,
yeah.
It does keep me up at night. So I think there's a couple things that I'd break out there. One is a distinction between psychological expectations about the future of climate change, which requires cogitating to some extent on climate change itself, thinking about the consequences for oneself as well as for the rest of humanity, and having a stress or anxiety response related to that. I do that all the time. But one other thing that's important, and it kind of as I think about my work, I try to distinguish, is that most of the time, both from surveys as well as empirically observed in the social media data that we have, it's very, very infrequent that people ever talk about climate change. And in a sense, the survey data also reveal that they don't think about climate change super frequently. And those who do think about climate change super frequently represent a demographic and political subset of the underlying population. And so when and kind of the idea that there's an ecological grief or a climate anxiety that underpins perceptions of future climate change, I think that's really a thing. And I think we need better studies of the degree to which that is a thing and how that accumulates and affects people over time. But my prior there is that given the infrequency with which people report thinking about climate change and the very substantial infrequency that they actually talk about climate change, I think there's a huge potential direct effect of exposure to changing climates, both in the extremes on the natural hazards, floods and hurricanes, as well as in the day-to-day changes of towards more extreme temperatures on the hot side, that if you just think about kind of the eco-anxiety, that will only be for a much smaller subset of the population than who, everybody is exposed. When you get hit with a hurricane, everybody in that city, regardless of your personal orientation towards climate change, is exposed to that stressor. And so I try to draw that distinction in my work, where I'm studying the main effects of climate on the population and trying to get that average treatment effect. Do I think that people who are really cognizant of climate are more likely to have a more acute psychological response to exposure to an acute climate stressor? Yes. I was in Bend this summer when we had air quality indexes in the 600s, and my friends and I are very concerned about this being the new normal and what this means for public health going forward in the West. And so not only was it absolutely terrible to have your living room smell like a campfire, but there was an additional psychological stressor on top of that. But even those people who weren't stressed by climate change and the future prospects of it were definitely stressed by the nature of the smoke exposure that we experienced. So it's a great distinction and a great question. And I want to emphasize one other thing that you said, which is, I don't know the empirical answer to this. I don't know whether or not future increases in severity and intensity of natural disasters will outweigh the day-to-day cumulative effects of exposures that everybody has to a changing climate. But I do know from the literature that it is a big and large and very robust effect of having trauma and stress and depression result from exposure to those acute stressors, some of the work that you've done as well. So I'm not exactly sure how the equation falls out. I think we'll need to do more work to know that for sure. But I think it's really important to consider both aspects.
Thanks, Nick. Yeah, more work for sure.
Always
is before us.
Yeah.
So following on from this sort of psychology focus, we have a question from Kimberly on culture, and her question is: do human cultures have different best nighttime sleep temperatures?
That's a great question. That's the first question that I had with respect to this result that we found. I did fieldwork in Ghana for my graduate studies, as well as Malawi and Uganda. And every time I went over to sub-Saharan Africa, I would have this, I mean, it really, I'd spend a month there and still not have great sleep because it would be just so hot and humid at night. But the people that lived there didn't seem to have that level of sleep disruption. And so there is some work that suggests between culture and between location alterations in sleep adaptation, that actually some cultures sleep a little bit less than others, and that might be related to the climates that they experience. But that is a really important question, and it has a direct bearing to the degree to which we're going to be able to adapt to those changes in nighttime temperatures over time. So it's still an open question as far as I'm concerned.
It is, and based on some of the work you presented today, this sort of computational capacity that is only growing day by day, and the ability to look at sort of global large data sets with micro sort of measurements of minute to minute sort of biometric data or social media data certainly presents, in my opinion, some opportunities to aggregate these sort of questions from individual level factors to country to cultural level factors.
Yes, very much so. And that makes me think of one more point on that, which is in the actigraph hour data that we have, that's global data set. And so we're able to break down the analysis by country. And we observe that an anomaly by country still produces, so a warmer nighttime temperature at the country level across all the countries still produces a reduction in sleep. And so it's really important as we think about these changes to note that at no point in time is the underlying temperature distribution likely to stop changing. Well, that's not true. At some point, a millennia from now, the temperature distribution will stop changing. But we will be continually moving from whatever our baseline was at the rate of anthropogenic forcing that we're inducing. And so what we see is unusually warm temperatures in Japan and in the United States harm sleep quality. And we will perpetually always have changing sleep temperatures. So maybe not at the rate at which we can adapt. It probably depends somewhat on the underlying incomes that individuals have and whether they can smooth it with air conditioning and all of these things. But exactly, with the higher resolution data that we have, the better data that we have on individuals, and the better data that we have on adaptation strategies, the more we're going to be able to answer those questions. Great question.
So to follow on this, we have a question from Jill about accounting for artificial climate control in the nighttime temperature studies.
Yeah, so we don't have that data. It'd be great if you had data on whether or not an individual had air conditioning. In some of our other studies, we've had more aggregate data. So what rate of air conditioning does the neighborhood that you live in have? But still there's some ecological problems there. Ideally, you know that this person has air conditioning at night and they use it, and this person doesn't. So what we estimate effectively is the average treatment effect across whatever distribution of use of air conditioning at night is. We estimate the average effect across that. So what that means is that sometimes, so in the Burfus CDC study, we found that lower income individuals had a much larger effect of an anomalous nighttime temperature increase than we did for wealthier individuals. It's likely that that's driven by access and the affordability of running the AC at night. So,
yeah, which speaks to these underlying questions of sort of structural and social determinants. So, let's see. We have a question moving into another topic from Danielle, who's asking about, have you included space travel factors in your climate change equations?
Space travel factors. I'm not actually sure what that refers to.
I don't think we have the option for Danielle or participants to clarify.
Danielle, send me an email and let's talk about that, because
yes,
I want to know what that actually is.
Perfect. So yeah, Danielle, please feel free to follow up with Nick after this. So as we wait for other questions to come in, I'm trained as a clinical psychologist, so I always go back to this sort of internal, affective world that we have. And it's a question that I've had thinking about social media data quite often. And we run into it even in psychological research, even thinking about self-report questionnaire data, because there's so many factors that go into what people choose to report in that moment, especially when it comes to their mental health or affective state. And you've said that this is you already are thinking about this as an assumption in your models that leverage sort of social media data. I wonder what you might, if you brainstormed, or where your thinking might be going on either methodological approaches that we might be able to leverage to get at this effect, or some alternative approaches to really understand, to control for all these things. We have to think about the person who is first on Twitter. There's already a selection there. The person who's willing to tweet about their feelings is sort of a different person. So how do you think about this?
Okay, so those are fantastic questions. And yeah, it's one of the things that's been bugging me for years now. Two things there. The first is, how do you know whether some sentiment-based expressions online are actually valid measures for underlying emotional states? I think that's kind of the formal first part of that question. And
yeah,
the answer is we don't, or we didn't. But what I've been doing with some, again, excellent colleagues over the last few years is we collected a data set from thousands of individuals on Twitter and tens of thousands of tweets. And we had an online platform where if you have a Twitter account, I'd say, okay, here's your most recent tweet. Can you recall your actual underlying emotional state? Not what you were attempting to convey with this tweet, but how did you feel at the moment that you posted this tweet? And what that then gives you is a still admittedly self-report and subject to bias due to memory, but a individual account of what their emotional state was at the point that they wrote a given natural language expression. And we have found that there is pretty good correlation across the broad affective dimensions between what people report emotionally feeling and what the third-party raters, so we've also hired a bunch of third-party raters to rate what they think the person was feeling at the time. And there's decent correspondence. So that third-party rating is the way that most sentiment classifiers up to this point, actually all sentiment classifiers up to this point, have been created if they use a validation set. And so we found good correspondence on like the broad affective dimensions of positive affect and negative affect, that the third party person was able to do a pretty good job guessing what the first party reported feeling at the time that they wrote that tweet. But with respect to certain dimensions of emotional states, the correspondence is much less good. So if you have things like embarrassment, an affective state of feeling embarrassed, the ability of a third party to guess that is very low relative to the first party report of it. So we're working on that study, but the ideal there is to establish which dimensions of affect have pretty valid correspondence between a third party rating and a first party report, and then make the assumption that that first party report is at least somewhat valid for what they were actually feeling at the time, subject to all of the limitations in affective measurement based on self-report, which are certainly substantial hurdles. The second part of your question relates to kind of the generalizability of these data. We're using Twitter data, we're using Facebook data. What does this actually tell us about the underlying sample? People who use Twitter are unusual. People who use Facebook maybe a little bit less unusual. People who geolocate their tweets on Twitter are unusual for Twitter. I wouldn't expect that any one sample that we look at is representative of the population. And so that's where trying to establish generalizability across cultural contexts, across sources and samples is really important. And so that we see the same basic functional form between geolocated tweets and the Facebook status of all individuals on Facebook from 2009 and 2012, and Weibo posts from China. The fact that this functional form looks very similar is compelling, to me at least, evidence that there's something quite general going on there. However, it could be the case that you just have a functional difference across the board between people who use the internet and don't. And until we have that same study of regular affective states of individuals not on the internet, it's going to be difficult to establish that conclusively. So.
Excellent. So I want to just be aware of time. We have about 4 minutes left. So I'll take the last question, and then Becca's going to conclude with some summary and announcement of the next forum. So this is from Jasmine, and her question is, given segregation and income inequality in the US specifically, how might we expect these findings to differ in communities where there is high versus low income inequality and segregation?
Yeah, it's a great question.
Yeah.
I am and try to be always cognizant of effects that the climate effects that we are likely to observe are almost surely going to be borne by within the US, the poorest individuals, and between countries, the poorest countries, and the poorest individuals in the poorest countries. In some of our studies, we've been able to have income-based information on the respondents, and so like I mentioned with respect to the sleep study, we observed that there were much larger effects of nighttime temperature, warmer nighttime temperatures on sleep for lower income individuals. And so I think that that's an area of import for future studies, as well as making sure that with these higher resolution data, we try as much as possible to get demographic covariates with the individuals in the studies to be able to look more specifically into those things. Because, for example, if most of the sleep effect that we observe is being driven, as we saw in the 2017 study, is being driven by or is much larger among low-income elderly people, and if you have a limited amount of money for a policy intervention to try to smooth those effects, then you try to spend that money helping low-income elderly people with their sleep hygiene, with better nighttime temperatures in the rooms that they're sleeping in. And that's a much better use of the money than just targeting a blanket approach to everybody. So it's a great question. And I think that the more that every study that works in this area can be explicit in attempting to identify the most vulnerable populations within the samples that they have, the better the work will be, and the more useful it will be for policy. So
yeah, I totally agree. Go ahead. This explicit structural focus is so important, not only for science, but for policy as well.
Absolutely. So anyway, I would just like to thank everybody for joining today and for your excellent questions. And if you have any other questions you'd like to reach out, send me an email. I'd love to talk.
Excellent. Thank you so much. And while Becca's wrapping up, I will post your email to the chat. And Nick, thank you so much for preparing and talking to us today. It was fascinating, and I'm excited to follow up, and hopefully others can also follow up with your email.
Well, thank you for having me. Very much appreciated.
Yes. Now I'll turn over to Becca, who's gonna, take us home.
Yes, thank you, Nick and Christy both for Nick for the great presentation, and Nick, Christy for your fantastic moderating and Q&A. I want to make sure everyone knows that we will post a recording of this event by Monday on Harvard's Chan Schools of Public Health's YouTube channel, as well as on our COVID-19 mental health website. Also want to make sure everyone knows we will be having our next event on November 18th at 11 a.m. Eastern Time. And it will be a conversation about Indigenous populations and mental health. So stay tuned for those information about that event as well.
Thank you.
Thank you.
Thanks, everyone.
Take care, everybody. Thanks again.
Bye.